Hello students, today I am going to discuss the bed sore, which is also known as a Decubitus ulcer. And firstly we see the content of the bed sore. Firstly we see the introduction of a bed sore and the definition of the bed sore. After that we see what are the causes of the bed sore, and after that we see the what are the risk factors for a bed sore, and then we have a pathophysiology of the bed sore, and what are the different stages of a bed sore, and what are the most common sites of the bed sore. Then we have a treatment and prevention, how to prevent and treat the bed sore, and what are the complications of the bed sore, and in the end some interventions are also included in this topic. So now move to the introduction part. Firstly we know that what is bed sore. Bed sore can happen during prolonged bedridden patient who are unable to move or patient who are unconscious. And in this patient, the pressure injuries are mostly occur on that area of skin that are under the pressure. And they can also relate it to the quality or care to the person received. Pressure injuries can develop if you must stay in a bed for a long time and you are not turned. So this is also a very important factor. As you can see in the diagram, this is a example of stage 1 bed sore. Then we move to the definition. What is the definition of bed sore? Firstly, bed sore is also called a pressure ulcer and a decubitus ulcer. And in this, it is an injury to the skin or underlying tissues result from a prolonged pressure on the skin. And bed sore most oftenly develop on that area of skin which may cover the bony area of the body, such as head, shoulder, elbow, buttock, heel and toes. While patient is in the lying position for a long duration, at that time there is a more chance of bed sore. So it is mostly occur in a bedridden patient or a prolonged bedridden patient, and mostly occur in those patients who are not repositioned after 2 hourly or 1 hourly. Then we have what are the causes of pressure sore. Firstly, first cause is pressure. The constant pressure on any part of the body may lead to the decreased blood flow. This is also a cause of the bed sore. Then second point is a friction. If the friction occur when the skin rub against the clothing or bedding, so it may also a factor which may cause a bed sore. And if the skin is also moist, so patient skin is more vulnerable to injury. And third factor is shear. If shear occur between two surfaces move in a opposite direction, for example, when patient is in the bed, you can slide down a bed, so at that time there may be a chance of friction in that patient, so there is a chance of a bed sore occur in that patients. Then we have three factors: pressure, friction, shear. Then what are the risk factors for a bed sore? Firstly, immobility. Due to the poor health status like spinal cord injuries or any other cause, patient is unable to move. In that cases, patient are more prone to the bed sores. And second risk factor is lack of sensory perception. Lack of sensory perception, like in case of spinal cord injuries, neurological disorders and other conditions, result in the loss of sensation. And loss of sensation means patient is unable to feel the pain. In that cases, they don't feel the pain or any discomfort. So at that time they don't know how to change the position at what time. And the third risk factor is poor nutrition status and hydration. People need a proper fluid, calories, proteins, vitamins and minerals in their diet plan. So we have to maintain the skin and prevent the tissue from any kind of damage. And last risk factor is a medical condition which affect the blood flow. There are various health problems that affect the blood flow, and some of them are diabetes and a vascular disease, which increase the risk of tissue perfusion or tissue damage. So it may lead to the bed sore. Then we have a pathophysiology of the bed sore. Firstly, due to the various risk factors, we have due to the various factors act on the soft tissues overlying the bony prominences. When the pressure exceeds on the normal capillaries, then at that capillaries the tearing of blood vessels occur at that time, and due to the tearing the reduced tissue perfusion occur in that area, and after that the ischemia occur, ischemia or necrosis. It is a condition in which the decreased blood flow to the tissues occur, and after that the deadness of skin occur, and then after that the pressure sore occur in that bedridden patients. And then we have a stages of pressure sore. We have a 4 stages of pressure sore: stage 1, stage 2 and stage 3rd and stage 4th. As you can see in the diagram, there are 4 stages. Firstly, in stage 1, the skin is unbroken but inflamed. In the stage 1, the skin is inflamed, redness and warmth occur in the first stage. And in the stage 2, skin is broken into the epidermis or a dermis. Then in the 3rd stage, ulcer extend to the subcutaneous fat layer. And in the stage 4th, ulcer extend to the muscles or a bone. It is a severe form of the bed sore. Firstly, we move to the stage 1st. In the stage 1st, the non-blanchable redness of the intent skin. Firstly, you know that what is non-blanchable. Non-blanchable means superficial redness of the skin. When it press, it doesn't turn white. In this stage 1, the patient's skin discoloration of the skin occur, warmth, edema and pain may be present. And it involve only a superficial layer, epidermal layer of the skin. And second stage is, and in the second stage it involve epidermis layer and the dermis layer, and ulcer may be formed in this, and the blister or abrasions are also occur in this stage 2nd patients. And bed sore should be, in case of stage 2nd, the bed sore should be cleaned with a saline water, and cleaning process will help to remove the dead tissues or damaged tissues, which is called a debridement. And in some cases the doctor will recommend a surgical debridement. Then we have a stage 3rd. In the stage 3rd, the ulcer is a full thickness tissue loss, and in this the subcutaneous fat may be visible but bone or tendon or muscle is not exposed in the stage 3rd. In the stage 3rd, it involves epidermis layer, dermis layer and the subcutaneous tissue involved in this loss. And subcutaneous layer has a very poor blood supply, so it is very difficult to heal. Then we have a stage 4th. In the stage 4th ulcer, it is a deepest and a extending to the muscle, tendon or a bone. In this, the full thickness tissue lies with the bone, muscle and a tendon. In this, the patient suffer from extreme pain, infection and invasive surgeries or sometimes even death. It is a severe form of the bed sore. Then we have some pressure areas which include buttock area, heels area, shoulder blades, back of head, back and side of the knees. Which are on, if the patient on the lying position, these areas are touch the surface, so they are more prone to get bed sores, like back of head, shoulders, elbow, hips, inner knees and the heels. These are the more prone areas to get bed sores. Then we have how to assess the bed sore. So we assess the bed sore by a Braden scale, which in this scale we give a proper values, and in this scale we assess these all factors are important in this Braden scale: sensory perception, moisture, activity, mobility and nutrition, and friction and shear. If patient are doing these activities completely very limited, then we give it a 1, a very limited 2, slightly limited 3 and no impairment, then we give a 4 point. And Braden scale values. In the Braden scale values, the highest possible score is 23 and the lowest possible score is 6. In the mild risk, it vary from 15 to 80. In the moderate risk, it is from 13 to 14. And in a high risk, it include 10 to 12 score. And very high, it is less than the 9. We consider it at a very severe level. Then after that, we have a preventive steps. The first step in treating a bed sore is reducing the pressure and friction that causes it. Firstly, repositioning. If you have a pressure sore, turn and change your position often, and it totally depends on the patient condition and the quality of the surface you are on. And if patient is on the bed, so we change the position every hourly. And repositioning is a very important step to prevent the bed sore. Then we have using a sport surface, like use a mattress, bed and special cushions are used to prevent the bed sore. After that, we have a cleaning. If the affected skin is not broken, then we wash it with the gentle cleanser, and sometimes we use a normal saline water, and after clean it, we definitely ensure that the dressing is changed every day. These are the most important step to prevent the bed sore from infection. Then next one is skin inspection is very important point. In case of pressure sore, we assess the skin daily for any kind of breakage or any kind of necrosis in the skin. Then the lifestyle changes. Person should quit the smoke, and exercise, daily exercise should improve the circulation. Then we have a next, putting on a bandage. A bandage speeds healing by keeping the wound moist, and this is also act as a barrier against the infection and keep the skin dry. And the bandage choice include films, gauze, gel and foams and treated coverings. You may need a combination of dressings also. And the last treatment step is removing a damaged tissues. Firstly, to heal properly, the wound need to be free of damaged, dead or infected tissues. So, and in case of debridement, we remove the damaged tissues from the body. And then we have a treatment to reduce the pressure sore. Firstly, we give the non-steroidal anti-inflammatory drugs such as ibuprofen, naproxen to the patient to reduce the pain and fever. And this is a very helpful before or after repositioning the patient, and in case of care during care of a wound care. During it also help us in the fight infection. And infected the pressure sores that are not responding to other interventions, such as which can be treated with the topical or oral antibiotics. And next one is a healthy diet is also a very good factor. Good nutrition promote the wound healing quickly. And then we have a negative pressure therapy. In this method, which is called a vacuum assistant closer, which is used to clean a wound with the suction. In this, we clean all the dead tissues, remove out from that particular area. And after that, we have a surgery. A large pressure sore that failed to heal might require a surgery. Sometime a flap reconstruction are also included in it. And flap repair is to use a pad of your muscle, skin and other tissues to cover the wound. Then what are the complications of a pressure sore? Firstly, we have a cellulitis. In the cellulitis, it is due to the serious bacterial skin infections, and in this the inflammation occur due to the entering of bacteria in the skin, and it is also a complication of the bed sore. Then we have a bone and joint infection. Then after that, the next complication is a sepsis. Sepsis is a extreme response to an infection, and it is a life-threatening medical emergency. And in this infection, it damages the tissues. And last one is a cancer. If patient suffer from cancer, they may have a more chance of a bed sore, because in cancer patients they are mostly bedridden in stage 4th, so they are also very prone to the bed sores. Then we have what are the role of the medical staff in prevention and the management of bed sore? Firstly, we have to assess the client for different factors. First one is a predisposing factors, and second one is a skin condition. At least twice a day we should assess and inspect each pressure site. Then after that, palpate the skin for increased warmth, and then we inspect the skin for dry skin, moist skin and break in the skin, and we evaluate the level of mobility. If patients are unable to move, in that cases they are very prone to bed sore. And evaluate the circulatory status. For example, in case of peripheral pulse and edema, we should assess the patient peripheral pulse, and in case of edema, edema, what is edema? Edema is the accumulation of fluid in the tissues. So we assess the patient for these two conditions, and assess the neurovascular status of the patient, and assess and determine the presence of incontinency, and evaluate the patient nutritional status and the hydration status as well. And what are the interventions to avoid the friction and shear? Firstly, reposition the patient by using a draw sheets, and after that we use a proper positioning techniques, and avoid dragging the patient in the bed like one position to the other position. use a comfortable device appropriately like pillow. Then we have interventions for a patient with decreased activity. Firstly, we change the position at least second hourly or hourly, more frequently for those who are at the high risk category. Or intervention for those who have a poor nutrition, provide a proper adequate nutrition and a fluid to that patient and assist with intake as necessary. And last one is consult the dietitians for a nutritional evaluations. Thank you. Firstly, to summarize the topic, firstly we studied what is the introduction of the bed sore. After that we studied what is the definition of bed sore, and then we studied what are the causes of the bed sore, and after that we studied what are the risk factors of the bed sores and what are the stages of it, and after that we studied the pathophysiology, what are the pathophysiology behind the bed sore, and after that we studied the treatment plan for it and what are the preventive measures, and in the end we studied the complications, and in the last we studied the interventions, what interventions should be taken by the medical staff. Thank you.